Hello and welcome to the HEWS Network's second episode. My name is Caroline Kithama. Thank you for joining me. Now, in the last episode, we were discussing about air pollution, specifically from exhaust fumes of motor vehicles in Kenya. And I ended up receiving great feedback from some of you, and for that I would like to say a big thank you. Please keep them coming in. I have a small story for you. Yesterday evening, I was at a mall with an aunt when a certain guy asked me why I had a face mask hanging on my chain. I briefly told him that it was because of the high levels of air pollution in Nairobi, and he mentioned that he was interested in knowing more. I asked for his name and told him that the next time I would visit that mall, I would look for him. I then took my auntie to a taxi to get her home, but then on second thought, decided to go back into the mall to look for the guy rather than go home immediately. I strongly felt that I should make use of this opportunity to create awareness. So I found him and we began to talk. He told me about his medical history, including where he previously worked, an area which had very high levels of exhaust fumes from cars. He developed 2 chronic illnesses, both of which are life-threatening. Due to his illnesses, the company he was working for transferred him to a different indoor location with the hope that it would improve his health. Now, I may not ascertain if the 2 conditions were 100% linked to the exhaust fumes, but I'm almost certain that the fumes were a major contributor, since both were distinct of the effects of inhalation of exhaust fumes over long periods of time. I was shocked beyond words, and for a few seconds I didn't know what to tell him. People like him are the reason I'm doing this, so that there can be awareness of what is going on around us and how in our own small way we can mitigate the situation. I found an interesting research done by the University of Southern California, which showed that elderly people living in areas of high air pollution have brains that are 3 years older, as cognitive function is affected by air quality. In other words, it makes the brain age faster than it's supposed to. Postgraduate doctoral fellow Jennifer Ailshire conducted this analysis using data from the American Environmental Protection Agency and the Health Retirement Study. She said, and I quote her, "As a result of age-related declines in health and functioning, older adults are particularly vulnerable to the hazards of exposure to unhealthy air. Air pollution has been linked to increased cardiovascular and respiratory problems and even premature death in older populations, and there is emerging evidence that exposure to particulate air pollution may have adverse effects on brain health and functioning as well." In the previous video, I had mentioned about particulate matter 2.5. If you remember, to just give you a picture of how small these particles are, PM 2.5 is 30 times smaller than the width of a human hair. So you can imagine how extremely tiny that is. It's not even visible to the naked eye. Road vehicles, factories, and power stations are the main man-made sources of these particles, which lodge deep in the lungs, in your lungs, in my lungs. We're also having issues of global warming, diseases like cancer, heart disease, and respiratory illnesses, like I previously mentioned. And also in this, animals are affected. There is also the issue of acid rain, which can cause harm to animals, humans, as well as plants. Unfortunately, due to lack of proper data in Kenya, we may not know the exact extent to which air pollution has affected us or is continuing to affect us. Thus, with the increase in cancer cases, heart diseases, and respiratory illnesses, we will continue dying, unfortunately, without knowing exactly what is killing us. Because if we knew, then we will put into place very specific measures to mitigate the consequences of air pollution. I would like in this episode to highlight some solutions that we could apply to try and cut down the rate of air pollution or to reduce pollution from motor vehicles. Drive less. The fewer miles or kilometers you drive, the lesser emissions you release. For example, instead of driving to the nearest supermarket, mall, or kiosk to do shopping, take a walk instead or use a bicycle. In some countries in Europe, one can hire a bicycle which you can use for the day instead of using a car. I believe we can adopt such an initiative in Kenya, beginning with Nairobi. Then take public transport when possible. Couple with friends instead of driving alone when going to work or when taking your kids to school. You can let your neighbor's kids hop in and then the following day you guys can swap. Use ride-sharing services. I think I've seen this with Uber if I'm not wrong. Plan ahead to make the most of your trips also. This is known as the trip chain, whereby the mall where you want to do shopping is near other places you need to visit. You kill two birds with one stone. Do it all at once. Work from home periodically if your job allows it. Then drive wisely. For those who drive, know this, that how you drive a vehicle plays a major role on, for example, how much fuel you burn. This way you'll also save money on the cost of fuel, which has gone up in Kenya. How you drive can determine how much emission you release from your vehicle. Have your car regularly maintained and serviced. Very important. The other thing is choose cars that are fuel efficient. When looking to buy a new car, look for vehicles that are fuel efficient with low greenhouse gas emissions to help preserve the environment while at the same time saving your costs on fuel. There is also the option of electric cars, which I hope will get to Kenya really soon. And also the plug-in hybrid electric vehicles, including the hydrogen fuel cell vehicles. Then there's also the option of using cleaner burning gasoline vehicles. This is a bit controversial in which one is better between diesel and petrol. Diesels produce 15% less carbon dioxide than petrol, but emit 4 times more nitrogen dioxide pollution and 22 times more particulates, which are the tiny particles that penetrate the lungs, brain, and heart more than petrol. So it is assumed that since particulate emission and nitrogen oxide emission threatens the world more than carbon dioxide emission, it is felt that a petrol engine runs clean. Then we have the reduction of traffic jams. Traffic jams are a key ingredient in air pollution, wasting of fuel and excess engine wear. Nairobi is notorious for traffic jam, especially during rush hour, and high levels of pollution get at this point. In the city where I lived in Hungary, the county government would, on certain days, not allow cars of a certain series, for example, KB something, to get on the road so as to reduce the level of pollution from cars. I think this is something that Kenya can also adopt. And then we have the use of efficient lawn and gardening equipment. This is for people who live in the leafy suburbs of Karen, Kitisuru, and other places who have lawns that need to be regularly trimmed. Gas-powered engines in lawn and garden equipment emit significant amounts of pollutants. Use a manual mower for small lawns. And when shopping for mowers and garden equipment, look for new technologies such as electric and battery-powered machines that are quieter and pollute less than gas-powered ones. Properly maintained and service lawn and garden equipment, just like cars, and change the oil as needed. If you are purchasing commercial grade landscaping machinery, a number of products are now available with advanced emissions reduction technologies, including catalysts and electronic fuel injection that result in significantly less pollution. If you own any kind of motor vehicle, motorbike, or anything that has an engine and is releasing exhaust fumes into the environment, you need to ask yourself, what kind of carbon footprint are you leaving behind? Just think about it. Last but not least, for you as a pedestrian, a mask like this one will really come in handy to protect your heart and lungs. It's not protective at 100%, but it sure could help save your life for now before we find long-term solutions. Don't forget to have it with you whenever you leave the house, whatever you are. So see you in the next episode of the HEWS Network, and you are also welcome to send in your suggestions on what topics you would like me to air, which you consider a pressing issue or issues in Kenya. I have already received a few, and you will see them right here in the near future. Tackling health, education, women and social related issues is what we are all about. You will benefit a lot from this channel, so don't forget to hit the subscribe and share buttons. Goodbye.